develop symptoms. And so anytime someone goes to work at a long-term care facility, they are screened pursuant to state regulations. You know, have you been in contact with anyone who's been infected? Do you have a fever? They take the fever. They do all these different things, take the temperature. Well, if you're asymptomatic and you haven't had any obvious contacts, then you're going to be able to pass the screening and go in, but of course, you could potentially spread that. So there was, we recently identified an outbreak at an LTC, Central Florida, 50 staff members, I think all of them asymptomatic, positive. At that point, the Florida Department of Emergency Management dispatched 23 staff members. Florida Department of Health was on scene to be able to pick up the slack there. But this is kind of the exception where you have that type of spread amongst the staff, but we are finding of 1 or 2, sometimes 3 or 4. If you're testing every 2 weeks like we are, you're going to be able to identify more and more of those before it spreads widely inside the long-term care center. That really is the name of the game, and that will absolutely, if you can prevent outbreaks, that will absolutely save lives. So we appreciate that arrangement that's allowing us to do that type of testing. We're also continuing with the antibody testing. We opened it up recently on our antibody sites, that some of our big drive-through sites. We had been doing first responders and healthcare workers, obviously can still do it. We're now saying anyone from the general public who wants to do it. And what we've seen is we've seen a significant increase in the percentage of people testing positive for antibodies over the past week, pretty much hovering about 10%, which is more than what we had seen. And you figure these antibody results really are probably reflecting infections that have happened 4 to 6 weeks prior, typically. So that's actually a good sign to see more antibodies, because that creates resistance in terms of the ability for the disease to spread. We're also working really hard to support our healthcare workers, to support our hospitals who are caring for folks who are ill. The capacity in terms of beds, as I mentioned, is strong. It really is the personnel is going to be the key. So I mentioned some of the people that we're deploying to Miami-Dade. We're going to be deploying over 1,000 people throughout the state very soon. We have the capacity to potentially up to 3,000. I also had a discussion today with the VA secretary. They have and we're offering different things, and I said, look, the personnel is really what we need, so we're going to be working with them to get some of their medical personnel to help supplement. It's been a long road for folks in the medical profession. This became something that was very earnest in March. We went through in April. You know, it was a little quieter in May for the general public and the beginning, but during that time, I mean, you had transfers from long-term care facilities. You had a lot of stuff going on in hospitals, and now obviously the pace is picking up even more. So it's really important that we do everything we can to support them. We also have a request that we think will be fulfilled in the near future from HHS for staffing, and we welcome that support. We are also up to 15 COVID-only nursing homes that have 1,000 beds available, and then we have 9 sites that are going to be on very soon with 600 beds. And this is really, really significant, because our policy from the very beginning has been you can't discharge from the hospital a resident of a long-term care facility who is COVID positive and contagious back to the nursing home, because obviously the fear is that that will infect vulnerable people. And so what happens is you end up having folks who are infected, they're in the hospital, but they are medically stable and really don't need continued hospital care. These facilities can serve as a step down so that the hospital can safely discharge a COVID long-term care resident to a COVID-only nursing home. Once they clear the disease, then they can go back to their original nursing home. You can also use it on the front end, that if somebody tests in a nursing facility, they can be transferred to one of the COVID-only facilities. If they don't need hot care, this is a place where they could do. So that's going to be 1,600 beds in various parts of the state. We've got a lot of them in southern Florida, and I think that'll be really, really important. You know, if you look at the hospices for folks with COVID, you do have a number of these folks who are in, who really aren't seeking or needing continuing medical care, but they haven't yet cleared the disease, and so they're not going to be discharged back to the long-term care facility. The facilities we have been accepting a lot of transfers. We're going to continue to do that, but I think that that's really an important tool when it comes to protecting the most vulnerable of us. You know, our guiding principles are Number one, protect the vulnerable. I think we all have a responsibility to look after folks, particularly 65 and up, who we know now are more susceptible to really negative effects from this virus than folks in other age brackets. If you are in one of those age brackets, 65 and up, or if you have significant underlying medical conditions, you really should be limiting your contact outside the home, shelter as much as you can, and certainly avoiding close contact with people who are not part of your household. This virus is circulating amongst the community parts of our state, particularly amongst folks who are in the younger age groups. So a lot of 20, 30-year-olds. We're seeing this, a place like Miami-Dade, you have a lot of the young people have gotten it, but it has spread to some of the older population, and I think part of that is family gatherings, friends, things like that in multi-generational households. So folks should be very, very cognizant if you're in those groups to take the necessary precautions. And if you're not in those groups, you have a responsibility to look out for folks who may be more vulnerable to this virus than you. We also are recommending that folks avoid what we've called the 3 C's, closed spaces, particularly with poor ventilation, crowded places, and close contact settings, particularly a close contacting for an extended period of time. And that's why the number one source of outbreaks has been the home, because you're under the same roof, in an enclosed setting, usually in close contact with family members for an extended period of time. Facial coverings are recommended, especially if you can't physically distance. You have some folks working in certain types of industries where they can't always maintain the 6-foot distance, but that will potentially reduce some of the transmission. So those basic things, I think, will really help us turn the corner. There are some positive signs in terms of, we've heard a lot about the number of cases. We are seeing some positive trends in different parts of the state on positivity that's declined in some key areas. We're seeing some other positive trends on some of the ED visits decline for COVID-like illnesses, but we got a lot more work to do, and but I have no doubt that we'll be able to do it, and it's going to be done by just having a steady resolve, not being fearful, but just understanding what's out there, understanding what we have to do, and understanding that we'll be able to get the job done together. So we're going to be working hard, to get the supplies, to get what people need. We're also going to be working hard, talking with folks throughout the state about some of the way forward in terms of businesses, schools, and all the important things that are so key to our daily lives. So thank you. Thanks everyone for doing their part. And with that, I'm happy to take some questions.
Yeah, Governor, in the last 24 hours, there's been some, the Department of Health has had to retell labs what results they're supposed to submit, both positive and negative. That's one of about a string of, I'm guessing, 5 or 6 things that have gone awry at the Department of Health, from press releases being recalled to having fights over data with some of the newspapers. Do you still have confidence in Dr. Ripke?
Oh yeah, no, of course. And first of all, with the lab results, just understand what happens. The law requires for reportable illness that if someone tests positive, it's reported. That's kind of the underlying law. We then said, I think in one of my executive orders, report the negatives too, and that's how we look to see percent positive and try to wait. And there were a number of labs who were just simply doing kind of what the default is, which is sending the positives only without sending the negatives. And so I don't think they were trying to be underhanded. Those labs, kind of what they were doing before this started, and so that was identified. I know they're going to start doing the negatives as well. So I don't think that was an issue with the Department of Health. I think it was more of an issue with the labs. Yes, sir.
There are some hospitals hospital earlier who has been reporting positive and negative case results this entire time, and they've seen discrepancies on that spreadsheet where one week their positive cases were missing, this week their negative cases were missing.
Which hospital was that?
It was Lee Memorial, and on top of that, Lee Memorial is listed under 8 different names through a spreadsheet, so they're going through trying to figure out, and for another example.
Yeah, no, I know Lee had one entry where they had pretty much only positives, and then they had kind of a bigger entry where they kind of had the negatives and stuff. That may be one of the reasons why Lee has always had a little bit higher positivity than kind of the other places in Southwest Florida. But I think Understand, this is labs using the Merlin system to put it in. So somebody, like the Department of Health just didn't put that in. Somebody inputted it that way. And just an issue. I mean, we're doing now 90,000 tests a day. So these things are being put in, and it's a huge amount of volume. And so we understand some of the labs, it always get reported as soon. And that's also why you look at like some of these test results, because it takes a long time to report them. In some ways, they're kind of a lagging indicator, because if I get results today and I see a case, that's somebody that very well may have been infected 2 weeks ago at this point. And so that's just something to keep in mind. So but we understand that, and that's just kind of the nature of when you have all the data coming in from all these different places, you got to do the best, I think the percent positivity is a pretty good indicator, but you do have to weigh that against the fact of maybe not all the negatives are there. I know some of the major labs, particularly in May, they were submitting the positives quickly and then they would dump the negatives. So if you look at all testing, the ramp up as we got into May, there was 1 week where there was like way more tests than we had ever done. And then we went down and then built back up. And that wasn't because we did more tests that week. It was because they had been having for 6 weeks negatives, and then they dumped all the negatives. And so I think with that day they dumped a bunch, we had like a 0.6% positivity. Well, that really wasn't the true number because of how the data was put in. Oh yeah, no, absolutely, yeah. That's not his fault for the tree stuff.
112 people were reported dead from virus today. That totals about 4,500 in the state. Senate Democrats had a meeting today, and they want to know how many more people have to die before you consider scaling back on the reopening plan.
Well, we're working hard every day to prevent not only the deaths, but obviously significant hospitalizations. I think if you look at all the efforts that we've done to protect the most vulnerable and compare that with some of the other states who did different policies and maybe didn't put as much emphasis on that. And we've had people from the Florida Healthcare Association, some of them say, we've been able to save probably thousands of lives when you look at all the efforts to protect our residents of long-term care facilities. And so it's something that we take very, very seriously. We're doing all we can because every life counts, and it doesn't matter whether you're 10 years old, 30 years old, or 90 years old. We want to be there and do the best we can to help folks, particularly those who are the most vulnerable to a nasty virus.
Back to school issue. I'm wondering, do you expect that the Department of Education is going to provide to local counties some protocol when it comes to what happens if a child tests positive? Who gets isolated? How all that, the mechanics, the testing of children. Is that all going to be part of this?
So I think what the department's doing is working with the State Department of Health, and then obviously each district